And on health matters, a section of health experts in the country want the government to set aside more funds to deal and combat mental health illness among Kenyans. Led by Addiction Prevention and Rehabilitation Association of Kenya chairperson Boniface Ndirangu, the experts said heightened political tension coupled with skyrocketing cost of living is the major contributing factor to high number of mental health issues in the country.
Health experts have warned that the culture of denial and silence which surrounds mental health issues in the country could only make things worse if measures are not put in place to curb it.
If they don't get any intervention, we are likely going to find ourselves in a situation whereby people and the economy generally gets affected.
And it's also good for people to be honest with themselves, to be self-aware when they feel like they've reached the limit, so that they can reach out for help.
We're beginning to see that this called love addiction of people who are compulsive and obsessive about their loved ones. And these are characteristics that people need to know. They assume that this is love, but in real terms it's an obsession.
Speaking in Nairobi during the official opening of Genesis Rehabilitation Center, the health experts said there's need to address challenges leading to depression among Kenyans, including high cost of living and joblessness.
For me, I remember I started taking alcohol at the age of 4 years. I didn't know myself, but I was able to come to terms and understand this is addiction and I need to get out of it.
When I was in rehab and many other rehabs that I've visited since, you find people referring to themselves as inmates, which gives the sense of like we're in prison and we're in, So even in the naming, we are Genesis Retreat and Wellness Center. Because that's what we want to embody. We want to tell people that, listen, you can come and you can recover in dignity.
With drug and substance abuse topping the list attributed to the rise in mental illness among Kenyans, the experts are now appealing to the government to set aside enough funds to deal and combat mental health illness among Kenyans.
Allocation of resources to really address the issues of drug and substance abuse, that we can have, just as other sectors get to have enough budget directed to issues of mental health. And because it's a fight that the professionals cannot win alone.
Lucky in the UK because the access to mental health and secondary care in general is a lot more developed, and we're hoping that here in Kenya this can become the norm as well.
Ben Chumba, Lunchtime News.
Victims of banditry in Baringo have